This is a future doctor of chiropractic here.
Brett.
Paulina, nice to meet you.
He's hanging out, picking my brain. And
cool, hang out. Come pick my brain. Come help my brain, actually.
Yeah. So you can have a seat over here. We're gonna.
How have you been?
I've been well.
Yeah.
You probably saw, but I hosted a seminar in Tahoe.
I was gonna say I saw that, and I also saw you go like
in
the.
plunge.
Oh my god.
Yeah.
You are insane. You made it look like it was warm. Oh my god, it's like this.
Well, I've done it a few times. Oh, sorry. I've done it a few times, so I think
You know what to expect.
Well, I was more prepared, but I didn't expect it to be like an ice layer on top. Because, you know, seriously, there was like a layer of ice. And I was like, oh, shoot.
I'm dying. I'm like, this guy's out of his mind.
Yeah.
I would be dying.
Yeah, so, yeah, but it was, I just, what happens is, I mean, it was definitely cold, is you have to breathe slowly. So you breathe really slow, and that way your nervous system doesn't go into shock. We're gonna do this. Sorry.
Oh shit.
Okay, he's gone.
Gonna survive out there. Alright, plunge yourself.
Okay.
This is insane.
Oh man.
Holy. The mental fortitude of this man.
Yeah! Kind of like what that guy does, where he can jump in, he can stay in cold water.
Yeah.
I can't think of his name.
So Wim Hof, I think.
Yes.
Yeah. The Wim Hof method.
Crazy.
He'll go hiking in the snow up like
high up and no oxygen or anything.
Yeah.
But it's like mind over body and matter and everything, I guess. So.
Kind of. Oh, sorry. Yes, he's a little late. So we have a. No, it's okay. We have another. It's okay.
I don't mind. Hi, friends.
Yeah. Yes. So this is Joan.
Hi, I'm Paulina. Nice to meet you.
Nice to meet you.
Brett.
This is awesome that you do this.
Yeah, I have lots of students come in.
Yeah. I just graduated. And,
Yeah, I'm gonna turn the air up over here too. So. Yeah, I'm a year in.
Okay. Okay. Cool.
You guys want to be chiropractors? Is that what you're studying? Very cool.
So he just graduated, and he's like in the beginning of his journey.
Where are you guys at?
I'm in San Jose.
You're in San Jose? I drove up from San Jose.
Oh, cool.
Yeah, I met him on a plane.
Oh, wow.
And I was like, oh, you need to help me.
That's awesome.
It's like, I have to come see you.
Alright.
I swear, I was supposed to be on that flight to meet you. You're going to help me with my vertigo. I know it.
Yes. So, yeah, so we will find out what's going on,
Yeah,
but definitely I've
no
helped
idea.
people with vertigo.
Cool.
So, like I said, the body's like a car. It's structural issues that can affect it, chemical issues,
Yeah.
and even brain-related things that can mess up.
I'm curious if it's like a sinus infection type thing. I mean, I don't
Well,
feel
it
sick,
could be a chronic infection.
And that's what you said.
Yeah,
That's what you
and
said.
it can also be related to an organ, and it could be related to, most likely though, usually it's related to some kind of infection,
Okay.
or a cranial nerve, brain issue, like a vagus nerve, something like that. So you've tried different things, and you've had this since January?
Since January, yeah.
Okay.
I've noticed, I've actually been feeling a little bit better since I've seen you.
Okay.
I think it's only because I'm on my typical diet, and
Okay.
I'm back in my own bed, and I'm not up in the air. And when we took that flight, I don't know if it was because
Yeah.
it was a smaller plane, but I felt it when we were up high.
Yeah.
I just shut my eyes the whole rest of the time, but when I shut my eyes, I had the spins. Like, this sucks. I can't live like this. It's
Okay.
awful. I felt like it was jet lag because I was traveling so much, so I thought my body was not adjusting well.
Mm-hmm.
And first thing in the morning, I would literally see stars. I could not move. I was kind of paralyzed, and I was throwing up like crazy. So I would take this other pill. Actually, I should
Yeah.
put that up. Take this other pill just to get my day going for photo
Yeah.
shoots. But I don't want to take chemicals and stuff like this all the time. That's
So you
kinda
ran
washed
out.
off.
Okay. Oh, that's still in here. Okay.
Yeah.
Good. Okay. Cool.
I've been taking that for nausea. It's just to kind of get me going.
So this would be the same thing that if you're on a boat kind of thing?
Yeah, I think so.
Okay.
I think so. And I don't know, my afternoons are fine, and come night, sometimes I'm okay, and sometimes I'm just so tired that the room kind of spins a little bit. But things have been better lately. but I still want to get checked. And I still
Okay.
wanna...
And mostly when you travel, how, like when you were on the plane or anything, did you feel different?
Oh, completely. At high altitude, I
Okay.
feel very lightheaded.
Okay.
Sometimes I get a little bit of spins.
Okay.
So I know it's pressure, and I know it's the high altitude.
Okay.
I was in Tahoe in December and was totally okay. So I don't think it's really altitude too much.
Yeah, it's just the traveling, the big descent. Okay.
Yeah.
And then I think I was asking you this before, but did you have any kind of like cold or flu or sinus
I
issues?
couldn't remember. I was trying to
Okay.
think about it. I really couldn't remember.
Okay.
I probably did. A clairvoyant told me. I'm crazy, guys. Sorry. I love mediums and all this stuff. But clairvoyant, she says, okay, you definitely have a sinus situation, and you went in a high altitude, and you just didn't balance well. Last week.
Okay, so tell me what happened.
Morning, woke up, very dizzy, fell,
Oh wow.
and didn't throw up, thank God. But it took me a few minutes to kind of just adjust and get up and take things slowly. Kind of felt it there a little bit, actually.
So I'm mostly going to work here, brainstem, cranial nerves, C1 also cervical plexus. We're going to affect this part of your brain. Okay. Yeah. So just relax. Nice. Beautiful. Good. So should we feel a big shift from that? So we're going to have shifts in both. So we'll just see if this is less tender.
Yeah, actually, I don't feel that.
Right. Not so good. Hold this up here. Squeeze your toes like this. A little bit weight there. And toes. Okay. So we're going to stimulate the part of your brain that controls your nervous system. Good. Feel a little funny. Breathe, breathe, breathe.
Actually, that feels really weird.
Squeeze your hand tight. Good. Hold this foot. Squeeze your toes tight. Nice. Okay. So I'm going to give you specific nutrition to repair those nerves that were damaged, mostly the vagus nerve. And then I'm also going to give you a supplement to help your muscles so they're not in spasm.
I'm heading out.
Yeah.
Gentlemen, I hope me as a patient was helpful.
Yeah, absolutely.
Yes.
I think you guys are in good hands with him, that's for sure.
Okay. All
I'm
right.
her mommy, Erin.
Well, welcome to the clinic.
Nice to meet
Yeah.
you. Okay.
I'm not sure. Were you adventuring with her too? Because she's been traveling all over.
She came home, and
Yeah.
I took off. I just got home Sunday.
How you doing?
I'm
Welcome
good.
back. Yeah.
How are you?
Yeah, doing great.
Nice to see
Great
you.
to meet your mother.
Yeah.
And you survived Hong Kong.
I
She
survived
did.
Hong
She
Kong.
did.
Yes. So tell me if this is tender,
A little ticklish.
ticklish,
Yeah.
but no pain.
Kind of, I would say
Okay,
like a
scale of
3.
3.
Yeah.
Okay. How about here?
Like a 1.
So you gotta release. Because when you get the brain working better, it fixes everything. So just let your head fall there. There you go. It's gonna be a little light. Good. Nice.
Nice.
Did you hear it?
Yeah.
And a tiny, tiny one here. So you drop. Good. There we
Wow,
go.
Pete.
Nice.
Yeah.
Beautiful. Okay, lay on your back face up.
Probably makes you like a little lightheaded, like ooh.
Oh, you should have seen me when you did my vertigo.
Oh, that's
Oh my
right.
god. He did one crack, he goes, how do you feel? It's like, I don't want to say perfect, but perfect.
Resist your off.
Okay. That's wild.
So that's why you have to
Oh my
restore.
god, I don't even feel the pressure on there anymore.
Yeah.
Not at all.
Wow.
It's a 0.
Good.
Yeah.
Yeah.
Maybe a 1 if that.
Yeah.
Let's see if there's
All right. So I had the lovely privilege of working with these two lovely women.
Hey, nice to see
And-
you again.
yeah.
Long
And-
time no see.
And I think the last time I saw you, or before I even saw you, had vertigo. So
Horrible
tell me-
vertigo.
So then, how was that treatment, and then how do you feel?
So the treatment was interesting with the muscle testing and just kind of seeing how you do everything. And you cracked my neck. First, before you even did that, you showed me on a diagram where you were going to do it. And then once you cracked my neck, you asked how I felt, and I laughed thinking I couldn't be perfect, but I was perfect. And I just went on a first big grand adventure since seeing him, and I was totally fine. No vertigo, no nothing. So Dr.
Awesome.
James.